You know, it's real easy to tell yourself not to drink and drive with 2 beers. But when you have 20, nobody's making good decisions, right? Okay? Or you're really high, you tell yourself, I'm not going to smoke out in public and everything, and then you start doing it because you're so high that you just can't think clearly, okay? Compulsion is when a lot of time is spent getting the drug or using it. In other words, your life starts centering around it. Okay, so you stop hanging, and you really know like compulsion is later stage when you start hanging around people at the end of your using that you would never hang around with at the beginning. Okay, I remember like going to my meth dealer's house at the beginning. I mean, those freaks stayed up for like a week at a time. And they were all psychotic, right? You know, they're a little they're paranoid as hell, you know. And like one of my drug dealers, one time she was going, come in. And I said, what? She goes, I think the FBI is watching me because you know what? I'm hearing birds chirping at night, Chris, and birds don't sing at night, man. You know, and she's like freaking out on me. And I'm going, wow, can I just have go? Because you're like scaring me now, you know? Like, if she was like, you want to hang out? And I go, no, I just want to get myself and go, right? At the end of my using, she said, hey, you want to hang out? And I go, yeah, you're my people now, right? You're my crowd. You're my tribe. You know, so it's like, yeah, I get some free drugs if I hang out. And you just stop losing that fear. So you start hanging, that's a sign of compulsion. My sister asked me one time, she said to me one time, she goes, I know why you won't go to McDonald's with me anymore. And I said, and you want to go to Pizza Hut? And I said, why? And she goes, they don't serve beer at McDonald's. You only go to Pizza Hut because they serve that dark beer you like. I go, no, I just like pizza. She goes, bullshit. Let's go to McDonald's. And I go, no, I'm going to Pizza Hut. She goes, well, I'm not going with you. Right? Because they don't serve beer at McDonald's unless you're in Germany. I've been to Germany. They serve beer at McDonald's in Germany. Okay, but they don't serve it in America. Okay? All right. And 12-year-olds can buy it in Germany. Okay. Obsession, that's when you constantly think about it. You think about, like, how do you keep your stash? That's obsession and compulsion, is always having a stash. And you know that it's also like getting later when you stop sharing your stash? Okay, that's a late stage addict. When you got a stash and people call you and they go, hey, you got any weed, you got any dope, you got any whatever, and you go, nope. But I come over and smoke some of yours. I'll do some of yours, you know, but I'm keeping my stash. Like at the beginning of using for a lot of people when it's a social thing, yeah, come on over, let's do whatever. Okay, later stage addicts, like me when I got that late stage, we guard it, okay? We always got a backup, we got a plan to keep that going, okay? You give up your important social, occupational, or recreational activities. In other words, it becomes more important than the people in your life and the things that you used to like doing. And the last one is if you continue using despite having physical or psychological problems. Some people like get depressed, and alcohol's a depressant, right? Or cocaine. You ever see anybody after a crack binge? Like the first couple days afterwards, how depressed are they? Suicidal? You know, they're just like, I remember after my meth binges, I'd be like, what's the point? I just want to die. It was so, because you get that crash, right? Because usually withdrawal is the opposite effect of whatever you use. So if you're a stimulant junkie, okay, you go crash down there. Alcoholics can't sleep at night. They get insomnia. They get more anxious. You know, if you have panic attacks, PTSD, and things like that, when you like get off the alcohol or the Xanax or the Valium, and you start getting off that, you get more anxiety at the beginning. You can't sleep, and you have more panic attacks and things like that. Okay, so, but you continue to use despite having that. Physical problems, like people who have liver problems, continue to drink on that. Ulcers, you know. We had a woman I worked with one time that she smoked crack. I came in the hospital. She got a liver transplant and a kidney transplant at the same time. And when she came in the hospital, she had cirrhosis, and she was so jaundiced that even, you know, the sclera, the white part of your eye, even that looked like an organic carrot. That's how orange it was, okay? I mean, she was dying. And that woman bought herself a new liver and a new kidney. Because I thought, how are you on the list? You were just drinking a month ago, and you're on the list, and you're like next? But they told her she had to be in the hospital for 6 weeks. So she was at Charter for 6 weeks, right? And she's on the list. And then she found out she had cancer of the lung. and they gave her a new lung on top of it. She got a kidney and a liver transplant and a lung transplant all at once. And I thought, how much money do you have? She bought her way on that. I know she bought her way on that list, right? And so she wasn't smoking, but she had, in spite of all those problems, before she came into the hospital, she kept, when you have cirrhosis of the liver, you get what's called esophageal varices, which are like varicose veins in your throat here, and they burst. And they go in and cauterize it then, because you're going to bleed to death if you don't. Okay, that's what happens with late stage cirrhosis. So she kept, like, in the hospital, she kept having her throat burst. And they had to rush her over to the hospital several times just to do that before she got the operation. So she got all three things done at once, which means basically they fillet her open like this, put the liver in, the lungs, then they flip her over. Well, then they put the kidneys in first. So that she was on her stomach and they put the kidney in back here, flipped her over, split her open, did all that. She was in surgery for like 14 hours. So she was real faithful about coming into aftercare, because at Charter back then, they gave you free aftercare for a year. You could come for every week, right? So for the first 4 or 5 months she was in, and she lived up at Wolcottville, up in that area up there, right? And so then after, like, she stopped coming in. And I was like, oh, where's Carol? What's going on with Carol? You know, like that. It was about 4 months later, I walked in, and she was sitting there on a Monday morning with a robe on, you know, like how they put you in the robes the first, like, 72 hours in the hospital. She's in a robe, got her legs crossed like this and smoking a cigarette on new lungs. And she'd been drinking. That's why she was back in. Because those anti-rejection drugs that they give you drugs so you won't reject the new organs that you have, and you have to stay on the rest of your life. They won't work if you drink or do drugs. They don't work. And all of her organs were starting to reject. She was starting to reject all the organs that she had just put in 7 months ago. And it was 1992, I'll never forget, and I looked at her and I said, you know what, Carol? I will never, ever be shocked anymore at the power of addiction. I'm amazed. I will be amazed constantly, but I'll never be shocked anymore. If you had told me that you'd be smoking cigarettes on a new lungs and drinking on a new liver, they sawed you in half like a magic show, you know, basically to get all this stuff in you. And all the stuff that you went through while you were here, I said, wow, I will no longer be shocked. I don't get shocked anymore when people say, can you believe they did that? And I go, uh-huh. It's amazing, isn't it? I don't get shocked anymore, though. I see people smoke crack on new hearts. Brand new hearts. 3 months later, they're out hitting the pipe again. And I go, you got a new heart. Wow, okay, that's a late stage dependence when you get over there. Okay, so yeah, is it? Yeah, I tell you what, I was amazed. So here's what happens to your brain, though. Okay, if you look at your brain, it kind of looks like this, and you have two parts to your brain. There's what they call this neocortex here. Okay, this neocortex, and then down here is your cortex. Okay, it's the base part of your brain. All of your higher functionings up here, especially up in your frontal lobe up here, your frontal lobe is where your reasoning and your judgment and your impulse control and your memories, like right behind that, right up in here, your ability to remember things, all that kind of stuff. Your cortex down here is where all of your primitive functioning is and all of that automatic stuff that you do, like breathing. It's where, you know, your speech is located, you know, all the stuff down here, more down this way, okay? It's also where, right here, in the cortex, this is your pleasure center right here. The technical term for your pleasure center it's called your nucleus accumbens, okay? And that's where the fight or flight and all of your pleasure center is. So like if someone comes up in there in your face, that's the part of your brain that lights up and goes, should I fight or run away? Okay, so your fight or flight's in there. Your sexual center's in there. When you get sexually aroused, this part of your brain lights up too, the pleasure center. If you go outside and have fun, you know, or you're just like in a crowd and you're having a good time, that's a part of your brain that lights up too and things. And so some people's pleasure centers, type 2 alcoholics, the kind of people that get that loss of control and really love it the first time they use, they don't produce as much dopamine in their pleasure center as other people do. And people with like serious depression issues, they don't produce as much dopamine and serotonin up in here in this part of their brain. So that when they use, like, I had a doctor ask me one time, like, when you like use meth, Chris, how do you feel? And I go, I feel normal. I feel happy. I feel good. I don't feel like, I don't get so off the wall. I just feel good. I just feel normal. And, you know, so type 2 alcoholics, we have a harder time in recovery because we just don't feel as happy as other people do just all the time. You know, my sister's the kind of person that I was down at her house, and down there in Charlotte, all the flowers have already come out and everything because they're like about a month ahead of us. And she has a garden out there and all the flowers are coming up, and I walk out and she's going, oh, she was so excited, right? She's, oh, look at the flowers, and isn't it beautiful? And she's, oh my God. And I go, uh-huh. Well, they're pretty. She's going, oh my God, isn't it just fabulous? You know, and I'm going, yeah. She goes, how come you don't, like, you're not excited or whatever? And I go, I'm telling you, they're pretty. Okay, I'm sorry I'm not having an orgasm over it like you are. You know, she was so giddy. And I thought, I don't get giddy. I just don't get like that, really, you know, unless I drink a lot of coffee or something, I don't know, you know, but she's like, she's just naturally a much happier person. A lot of us in recovery, we think we're doing something wrong because we're not as cheerful as like other people, and we're like, that's just not us, okay? And it's just kind of who we are. But we're so used to like chasing that. Sometimes we're just using to feel normal now, okay? So all drugs though, here's what happens with all drugs cross the neocortex. They cross over the blood-brain barrier. This is the outer part of your brain. All drugs have to cross that first before they go down to the cortex, because your breathing is more like down at the base of your spine here and everything like that, and your speech and all those other kind of things. So let's just take alcohol. You know, if you have some, you don't start slurring your speech until you start getting more drunk, right? Okay? But your impulse control can be impaired because your impulse control and your judgment and your reasoning and everything's up here, and you can start forgetting things more before you start slurring your speech. Okay, so that happens more right away before you're going to start losing control, and that's your balance is down here too. So, you know, the drunker you get, the harder just, you know, to walk and things like that. And things that gets more affected the more drunk you get. So that's more down here, okay? The thing about the pleasure center though, it's directly connected to the neocortex. And the reason is this, is because your pleasure center has to have a shortcut in order to be able to react to like threats and things like that. Your fight or flight center has to, you know, and it's like, what's your first name?
Kevin.
Kevin. Okay, so like, let's say I walk up to Kevin and I pull a baseball out from behind my back and I just throw it at his face, okay? Now Kevin doesn't have time, right, for this part of his brain to kick in and say, he doesn't have time to sit there and go, what the hell's that all about? Chris doesn't seem like an ass. Why'd he throw a ball in my face? Okay, like what's up with that? Do you think I should duck? You know, he doesn't have time to turn over and go, hey, should I move? Like, what should I do? He's just going to do this and then get like that, right? Okay? You have to protect yourself. So what happens is that when you use, this part of your brain lights up. It starts getting activated. Okay? The more you use, the more that this part of your brain gets shut down and impaired. Okay, so that's why it's harder the more that you use. If you're like me, that loss of control, immediate, like the more you use, the harder it is to tell yourself not to do things that put you at risk of getting in trouble. That's why that happens in this part of the brain up here. Also, this part of the brain, most alcohol and drugs are neurotoxins, which means that it kills brain cells.